swap heights are. It's kind of a let me add on, you know.
Our hospitalizations are not the highest point, even though the language says it's among the highest, right? It was, yeah, we're 2022, because we were at 2,312, I think was the peak.
Okay, we're taking this live right now. Just okay.
No audio.
Well, I have to put it up because they're taking this live.
Okay, well, we'll just.
I'm ready to go anytime.
All right, we'll go in. All right, we'll go in 1 minute.
Bless you.
Okay, we're live right now.
Okay.
He's live on our stage.
Okay, well, let's do it in 10, 9, 8, 7, 6, 5, 4.
Good evening, Los Angeles, and thank you as always for joining us this evening. Today is day 139. Our lives are altered, our livelihoods challenged, and too many of our lives have been lost. But tonight, as we gather in our homes, as we are together with our loved ones, in what seems like a never-ending struggle, I want to share with you tonight news that will continue to propel us to saving those lives and livelihoods, to taking, yes, our altered lives, but doing something of purpose with them, to make sure that this chapter of Los Angeles' challenge to COVID-19 is one that we all can look back and say we are proud of what we collectively did. This is, at a moment, a very fragile position. We're in a precarious place with cases and hospitalizations still at some of the highest that we have seen during this pandemic. In other words, this is a make or break moment for Los Angeles and our response to COVID-19. But the work that you have done, the love you have brought forward, and the way that we are learning from this pandemic each day. Tonight, as I address you, the COVID level is still at orange. Our threat level remains there. We plan no further closures at this moment on any activities or businesses in the city of Los Angeles. And the latest guidance from UCLA infectious disease expert Dr. Robert Kim Farley suggests we may see cases begin to go down in the next couple of weeks, averting any further closures. But only if we continue to do our part. Only if we act individually and collectively to prevent the spread of this virus. As of today, more than 150,000 fellow Americans have died at the hands of this disease. The United States still has one of the worst outbreaks anywhere in the world, with over 20% of the world's deaths and not even 5% of the world's population. In order to defeat this virus, in order to get our economy back and to bring our students back to school, we all need to be on the same page. We all need to wear our masks and continue to. We need to wash our hands and our surfaces. We need to physically distance, no matter what our age is, and not gather with anyone that's not a part of our household. It's that simple. It's what scientists tell us, and those are the facts. Don't listen to conspiracy theorists or those fringe media outlets who are only trying to divide us. We know that we can beat this virus when we stay together, when we stay vigilant, and the data demands nothing less. Some positive news is the county now estimates the transmission rate is now down to 0.92. That's down a little bit even from last week, where we, as I shared with you, went under that magical 1 threshold. Last week it was 0.94. This represents that what you are doing is having an impact. It's estimated today by the county that 1 in 450 residents of LA County is currently infectious. That too is down from just last week, when it was estimated that 1 out of every 320 of us was infectious. This is positive news. It shows that our actions work. And over the next few weeks, I hope we will keep up what we have done over the last few weeks. I've been asked by a lot of media and interviewers nationally and locally, has the message been received? And I think this data shows us, yes, people have received the message loud and clear, but we can always do more. Today, the county reported 4,825 new infections, bringing the total number of positive infections cumulative to 183,300 were in the city of Los Angeles, bringing the city's total to 74,669. Hour period, but instead a data backlog. So we look at the 7-day averages, which remain low. The county also reported 91 deaths, the highest number of deaths yet, not just from the last 24 hours, but from some days before as well. Nevertheless, that brings our total to above 4,500. It's now 4,516 people who have perished in Los Angeles County. As I mentioned, we believe this is due to a reporting backlog as well. 30 of these deaths were here in my city, the city of Los Angeles. 6 were in Long Beach and Pasadena, which have their own health departments. Our averages are currently 2,695 cases a day over the last 7 days. Of the 85 deaths in LA County that were not in Long Beach, 72 of them, or 85%, had some sort of comorbidity, which is the term we use to describe pre-existing health conditions and age vulnerabilities that make them especially vulnerable to dying from COVID-19. 57% of our deaths were men, and the ages of the deaths were widespread, including 3 deaths among people between 18 and 29 years of age, and 7 people between the ages of 30 and 49. 17 of the 85 were in congregate living settings, and that percentage is way down from the beginning of this, when you'll recall half of the deaths we were experiencing were in congregate living. Of the total deaths that we have now in Los Angeles County, over half of them remain institutional, excluding again Long Beach and Pasadena. 2,222 are in institutional settings. 2,021 are deaths outside of our institutions. In other words, in the general public at large, outside of those institutions, 2/3 of the deaths are men and 1/3 are women. So men, mask up. Men, take responsibility and socially distance. And men, make sure you are washing your hands and your surfaces. Our hospital inventory remains stable, and across the county, there are 600 available beds, including 465 acute care beds and 135 ICU beds currently available, as well as more than 1,250 to be exact, available ventilators as I speak. And while the county's hospital demand shows overall a much higher number of hospitalizations in LA County than in months past, there's some good news, which is that we are now seeing a steadying of our hospitalizations. And this will only further improve if we keep up our hard work to flatten the curve down further. Today, we have 550 ICU patients who are severely sick. And to everybody who has lost somebody, my heart goes out to you. And to everybody who's watching somebody hang on in the ICU, we are with you in our thoughts and our prayers and our love. Those 550 ICU patients represents a 17.3% increase from last month, but it is almost a 12% decrease from just last week. Also, some nominally good news. And as of today, 1.7 million people in the county have been tested, and the cumulative positive testing rate stands at 10.1%, up slightly from last week at 9.7%. Within the city of Los Angeles, at our drive-through and walk-up testing sites, we have tested nearly 1 million people, 920,000. And the cumulative rate of persons who are testing positive in those sites is 6.9% in the city of LA, up a little bit from 6.4% last week. So hospitalizations are coming down slightly. We're seeing cases come down slightly. but we're also seeing positivity go up slightly, even as the infection rate comes down. I know those can be confusing. Your work is making a difference. We're not seeing all of them go up, but not everything is going in the right direction yet. All Angelenos need to exercise extreme caution, and if you think you've been exposed or you work in a high-risk environment, go get tested at your doctor or your medical provider, at a CVS, a community health center, or a city, county, or state site. 18,500 people this week. We're continuing to send our mobile teams out. I joined the mobile testing team at Nickerson Gardens Housing Development, and today our testing teams are out there tests at Central Lutheran Church in Van Nuys and the William Mead Housing Development in Lincoln Heights, north of Chinatown. Prioritized for people who have symptoms, who think they've been exposed or who are essential workers or work in high-risk environments. As always, find out where the nearest testing site is to you by going to coronavirus.lacity.org/testing. And if you'd like to schedule through the city, you can fill out the form there today or call 311. And remember, when you get a call from somebody from the County Department of Public Health, this is a contact tracer and a critical call that you should answer. Or if you get a voicemail, call back. These are not law enforcement officials. They won't ask you about your immigration status. They are here to help protect your loved ones and coworkers and family members. They need to know who you've been in contact with so that they can isolate and quarantine, and we can continue to save lives. We're continuing to look for ways to make this reality and this adjustment to COVID-19 better, to make our cities safer and to make your lives easier. We know that some people are still traveling for essential work. And last month at LAX, I announced that we were setting up thermal cameras at Tom Bradley Terminal outside the terminal, the first airport in America to do this before people go into the terminal, as a pilot project to help identify travelers with body temperatures over 100.4 degrees, because we know that is one of the leading symptoms of COVID-19. Our next step that I'm announcing tonight to stop the spread of COVID-19 is our new Travel Safely Ambassador program at LAX. To encourage passengers to wear masks, which are required at LAX starting on Monday, our travel safety ambassadors will be at to those who need them, as well as fact sheets that are detailing all of the safety measures that are in place. Mind when you travel, and we can all stop the spread. It's the deep cleaning that we're doing in highly trafficked that are all around you. And these ambassadors will be easy to spot. They'll be wearing travel safely buttons, mask use. Ultimately, the goal will be to have ambassadors in every single terminal. We'll start with Terminal 1. Provides you with world-class safety. We're doing everything we can to protect everybody who's in need, to protect our most vulnerable, to stop the spread, and to save lives. One of the ways I've shared that we're doing this in Los Angeles County and the city as the partner with our county government is a city initiative to rent hotel and motel rooms for Angelenos experiencing homelessness who are I want to share good news with you that we have secured yet another hotel, this time in the southeast San Fernando Valley. Of hotel and motel rooms to nearly 4,200 across the county. We always have food providers and service providers at each hotel. I've worked at one of those hotels handing out food. It works incredibly well and it keeps all of us safe. I'm extremely grateful to everybody who is working, especially our disaster service workers, LASA, and our service providers who are making Project Room Key work, and we're working with Project Home Key, the state initiative to make sure people go from those hotel rooms to permanent housing as well. But one thing I've made clear each night is there's only so much that we can do locally. We need help from Washington, and boy, do we feel that this week. Too many Angelenos are facing that cliff on Friday of unemployment benefits that will run out. You're not sure how you're going to pay your bills, stay in your housing, feed your family. All of the stress that came at the beginning, which Congress stepped up and helped us get through. Now, partisanship, threatens. And right now, on Friday, it may be that Congress does not bring together a solution to extend those benefits to Americans who are hard hit and hardest hit by COVID-19. Today, we heard from the White House that we are, quote, nowhere close to a deal. Well, before Congress or anybody else in Washington, D.C. takes a vacation, before they go on a break, they should do what we're doing, working around the clock, everyday Americans who are struggling to get through this crisis, and they need to do their job and extend unemployment benefits, bring local and state aid to those first providers, those first responders and providers who are working in our hospitals and answering our ambulance. A country, unified, united, tossing aside partisanship to do the right thing and to first, those expanded unemployment benefits expire. 830,000 of them live here in Los Angeles. They had filed claims by July 4th, and they are counting on you to do the right thing. The easiest thing to do would be for the Senate to pass the HEROES Act, which has already passed the House of Representatives. It could happen as quickly as tomorrow and bring aid right away. And additionally, I was happy to hear the news today that a judge in New York blocked the government from implementing the public charge rule nationwide. In the midst of a public health crisis, this news gives immigrants the peace of mind about accessing life, saving resources for themselves and families, and does not discriminate against immigrants who contribute so much to America. If you need care to prevent or to treat COVID-19, you should be able to seek help without fear. Good news today does not mean good news tomorrow, so don't let your guard down. This virus preys on us when we are relaxed, or when we are exhausted, or when we are divided. So we will not relax our vigilance and fail to wear a mask. We will not relax and forget to wash our hands. We will not be exhausted and forget to physically distance. We will not allow any of this to blind us to the reality that COVID-19 is still here, is still taking lives of our loved ones, and is as dangerous today as when we started. And here in Los Angeles, we will show what unity is all about, that we are not divided, that we will all do our individual and collective parts to flatten the curve and to save lives by staying safe, by staying healthy, and when we can, by staying home. Strength and love to everybody out there. Thank you, Los Angeles, for all you're doing. Evening as well, so we will try to fix it, and we will be right back with Q&A and Spanish. So hang on. That's happening.
No, I mean, it kind of changed throughout.
Do you
So.
think,
Okay, it sounds like everything from me is, this is all time. So that's, I can give you that number to talk to them. No, okay, no, I know, it's a terrible situation to be here, I know that it's not working back there, but everything here is great. Yeah, no, sure, it's all good, I just want, I don't know, I mean, I talked to them, so I don't know what's happening back there, I'm sure they were trying to.
I don't know.
I've been texting with the station Jeff. It sounds like it's a problem with like the cable company. Yeah.
That's why we should cut the cord. Tonight I'd like to talk to you about subscribing to YouTube. Sure, premium costs a lot. You're used to the free videos, but so
Yeah, so we're gonna go back up in a second.
But sorry, before we go back up, what's the game plan? Am I going back and redoing something? Am I just running through?
No, just the Q&A, but we wanted the feed to
I'm
be.
happy to do whatever people
Okay.
want. People want to get in.
Go ahead.
Maybe if you gave a 90-second English, just recap, I mean, do you think other stations are gonna take?
I don't know that.
I mean, my recommendation You do Q&A in Spanish. Then we're done with live TV, and then you deliver it to Facebook Live. Okay?
Yeah, I mean, folks also, if it does get fixed and they see it's fixed, I know it's 6 o'clock or 6 o'clock, whatever.
Yeah.
So,
I don't think we should we advise that we're about to go live Q&A in Spanish?
it's only our, 74th address or whatever, so it was bound to happen sooner or later.
Yeah.
So I think we do Q&A in Spanish, and then we do Facebook Live directly.
Well, why don't we see what happens with it?
Can I just have one minute?
Yep, take your time.
Hey, how are you?
I really never been better.
So,
Not good to see you,
I was watching my hand.
Yeah, I said, oh, let's put all sorts of words in out there.
He still has to do Q&A, we have
Stuff
to
that's
do all
not in here,
comments
but I'm
on
gonna
it.
say,
But is this an issue?
other than that, stuff from the side. Because you always know how to spell too, that sounds like that.
Yeah, you're on the phone with the cable company and.
Right.
No, I understand that. I know this is an ABC issue. I was just trying to get a sense of like whether this is like
Well, coming off
something.
the camera, yeah, we're gonna run into the switch directly off your camera. Instead of going through back to your station and then out to the switch, we're gonna go straight
So
from
we
the
need
switch.
to go to Facebook Live.
So, if.
It is.
Just so I understand, are you
So
bypassing
we'll pick it back up.
my station then in the sense
Yeah,
that,
yeah.
so I don't need to send them a
Okay,
signal?
but I mean, they're talking and, okay, so I just wanted to get a
There's
sense of
different,
whether
like,
this is something that's.
different outlets on here,
Sure, it's
one
fine.
is a higher
I know it's
quality,
something
you
we got,
wanna
so
send it,
I just,
but
you know,
you're not using.
we're here with him, we
Yeah,
have to do the
higher
Q&A
quality.
and we have.
Also get the same feed, it's just gonna be the other way.
Right, okay, that's fine, I just wanna make sure I understand before.
Beyond the.
Yeah, so we're not online anymore, so if you wanna ask your engineers what the deal is, I think we have probably 30 seconds to a minute, but we've gotta go back up.
Yeah,
and
it is.
Spirit in a couple
Oh.
minutes. Okay, I appreciate that, okay.
I don't think it's that close.
Okay. Alright, so this isn't this isn't gonna get fixed in the next 30 seconds to a minute. So I think we need to go back up and do the Q&A. Yeah.
So what's it, sure.
Well, the Q&A, yeah.
Well, it's surprising, that's not really hard normal days, but I don't go out to like 10. Either way. Well, process and whatever, weekend.
Okay, so what's happening on mine right now? To send a signal directly to switch, therefore we are done. I understand for sure, but I guess I'm powering down the echo.
Is 35 gonna do something here?
Broadcast ourselves at our usual coordinates.
Do we need to let the broadcast stations know that?
Diana's working on it.
Okay, Diana and Harrison. Alright.
Trying to help.
How long are we, do you think?
Hey guys,
Yeah, what's up?
sorry to interrupt.
No.
Switch now.
Okay.
From what, I just wanna make sure, is that coming through on their city line so that we can then, as a station, get it?
Wait.
Because I'm no longer gonna be feeding. to
We're
my
advising
station.
this with coordinates.
We're gonna send it to the.
Yeah, okay, I just wanna make sure.
Diana's sending it to them
Yes,
right
we're calling all of
now,
them.
with our regular coordinates.
Of course,
Okay.
yeah. So it's our regular coordinates through channel 35.
Okay, so regular coordinates through channel 35.
It's just when you wear masks.
I'd say, I'm not sure, we're plugging in. Yeah, I can text you for sure, but I'm gonna. Okay, thanks, man. Bye.
Are we starting with Q&A in Spanish and English? Or are we starting?
I think that we're restarting. We're doing the English.
The whole speech? Oh, we're doing the whole speech over again?
It's
The problem is these are.
it's your call. I mean, we do have